In this video, I am going to discuss three major topics. First is about health assessment. Second is about collecting objective data through physical examination. And then the third one is about the physical examination techniques. So let's start with health assessment. So the assessment phase, which includes collecting subjective and objective data of the nursing process, precedes the other phases in the nursing process. So lagi nauna si assessment phase, followed by the diagnosis, then you have the planning, intervention, and evaluation. So you have to be aware that assessment is ongoing and continuous throughout all phases of the nursing process. Although nauuna lagi si assessment phase or yung ating nursing assessment, however, it is a continuous and ongoing process throughout the nursing process that we have. So tuloy-tuloy siya in all um, aspects of the nursing process. So when we say health assessment, it is more than just gathering information about health status of the client. It is analyzing and synthesizing that data, making judgments about the effectiveness of nursing interventions, and evaluating client care outcomes. So hindi lang tayo nag-assess or nag-gather ng information when we talk about health assessment. We are talking about critical thinking here when we assess our client. And of course, we are also performing the judgments, and then uh, we are also taking into consideration the effectiveness of the nursing interventions and then evaluating client care outcomes. So when we say a comprehensive health assessment, it consists of both a health history and physical exam. So remember, pag sinabing comprehensive health assessment, it includes, we have health history, yun yung, that is the first, and then it is followed by the physical examination. So yung health history, na-discuss na natin siya in our previous discussion. So yun yung una nating ginawa, your interview and your health history taking. So that is the first. So later on, we will be discussing about the other part of a comprehensive health assessment, which is physical examination. So the purpose of a nursing health assessment is to collect holistic, subjective and objective data to determine a client's overall level of functioning. So, ang pinaka gusto natin mangyari when we are conducting nursing health assessment is to gather holistic information, which comprises of the subjective and subjective and objective data that is from our client. So or from our client or from the patient that we have. So the nurse collects physiologic, psychological, cultural, socio-cultural, developmental, and spiritual data about the client. So meaning, it is a holistic data collection. So all aspects ng ating pasyente ay kinukuhanan natin ng data, not just the physical or not just the functioning of the client, but also all other aspects such as spiritual, socio-cultural, and the things that I have mentioned earlier. So in contrast, yung physician performing a medical assessment sa mga doktor, So they focus primarily on the client's physiologic status. So talagang sila, they're focused sa physiology ng mga patient or ng client natin. And then less focus may be placed on psychological, sociocultural, or spiritual being. So that's the main difference between medical assessment and nursing health assessment. Now, we have two types of health. We have four types, sorry. We have four types of health assessment. First is the initial comprehensive assessment. So for this type of health assessment, it involves collection of subjective data about the client's perceptions of his or her health past health history, family history, and lifestyle and health practices, as well as objective data through physical examination. So, pag sinabing initial comprehensive assessment, ito yung una pa lang na assessment na ginagawa natin sa ating pasyente, and that is comprehensively. Okay, thorough natin ginagawa yung assessment because this is the initial encounter of the patient to a healthcare practitioner such as nurses. So lahat ng aspeto na nabanggit natin kanina, health history, and then the physical exam, thoroughly and comprehensively kinukuha natin sa kanila in this type of assessment. So a total health assessment is needed when the client first enters a healthcare system and then periodically thereafter. So the first time na magpunta si client sa hospital or sa clinic, again, comprehensive yung assessment or total health assessment yung kinukuha. And then periodically thereafter. Okay, so the next type of health assessment is an ongoing or partial assessment. So it consists of data collection that occurs after the comprehensive data is established. So ibig sabihin, kapag meron na tayong thorough health assessment or database from our client, dito na papasok yung ongoing or partial assessment. Okay, kasi meron na tayong comprehensive history or physical exam or kumbaga data from our initial encounter with the patient. So it consists of a mini overview of the client's body systems and holistic health patterns as a follow-up on health status. So any problems that were initially detected are reassessed to determine any changes from the baseline data. So kumbaga, follow-up assessment itong ongoing or partial assessment so that we can reassess kung nagbago ba, nag-improve ba yung dating concern ni pasyente. Okay? Kung meron bang changes, improvement, or baka nag-worsen pa yung kanyang certain condition. So that is where we do the ongoing or partial assessment. So hindi siya ganun ka thoroughly. We are just like reassessing the problems na initially na-detect natin sa ating pasyente. And then this type of assessment is usually performed whenever the nurse or another healthcare professional has an encounter with the client. So, basta meron na tayong comprehensive database or health history and physical exam with our patient, so ongoing or partial assessment na yung pwedeng mangyari sa mga susunod. Okay? Next, number 3, we have focus or problem-oriented assessment. So in this type of assessment, it does not replace the comprehensive health assessment. So it is performed when a comprehensive database exists for a client who comes to the healthcare agency with a specific health concern. So parang yung number 2 natin, si ongoing or partial assessment. Pero in this case, again, meron na muna tayo dapat na comprehensive database or meron na dapat tayong data sa kanya, thorough information na nakuha sa ating patient. And then, so that for example, nag-visit ulit si patient in our clinic or in the hospital, with a specific concern or with a specific problem. So yung problema lang na yun, yung ating titignan thoroughly. So it's not it is not the review of all systems of the patient or review of all aspects of the patient, but kung ano lang yung concern niya or yung problem niya during that visit, yun lang yung pinaka-focus, yun lang yung pinaka titignan na nating mga healthcare professionals because that is the immediate concern of the patient. So problem-oriented tayo. And then again, dapat meron na tayong comprehensive database. Okay, for bago tayo mag-focus or problem-oriented assessment. Okay. Next We have number four. Okay. So another additional. So a focus assessment consists of a thorough assessment of a particular client problem. So yun nga, kung ano na yung problem, yun yung titignan and does not cover areas not related to the problem. Okay, so number four, the next type of health assessment is emergency assessment. So when we say emergency assessment, it is a very rapid assessment performed in life-threatening situations. So ito yung assessment na ginagawa kapag emergency yung condition ni patient, kapag life-threatening. Okay, so kung ano lang um, yung pinaka-eminent na system na dapat tignan because the patient is in danger, yun lang yung titignan. Okay? So, in situations like choking, cardiac arrest, drowning, so an immediate assessment is needed to provide prompt treatment. So, an example is the evaluation of the client's airway, breathing, and circulation, known as ABC. So, airway, breathing, circulation. So, that is ABC. When cardiac arrest is suspected, that is an example of an emergency assessment. So, ginagawa siya during emergency. So, those are the four types of health assessment. So, you have comprehensive, you have partial or ongoing, then you have yung number three natin, that is focus or problem-oriented assessment. And then number four is the emergency assessment. Next, we will now proceed with the different steps of health assessment. So the assessment phase of the nursing process has four major steps. The first one is the collection of subjective data. That is the first step of health assessment or the assessment phase. Next, collection of objective data. So laging subjective muna, followed by the objective. Third, you have the validation of data. And fourth, you have a documentation of data. So these steps tend to overlap and you may perform two or three steps concurrently. For example, so nag-overlap yung apat na yan. Ano? For instance, you may ask your client if she has dry skin while you are inspecting the condition of the skin. Okay, so nagtatanong ka while you are inspecting the condition of the patient. So if she answers no, but you notice that the skin on her hands is very dry, then validation with the client may be performed at this point. So nakita nyo na yung subjective, yung objective, and validation, it's overlapping in this example. Okay, so nagtanong ka, subjective, and then in-inspect mo objectively, and then validate mo pa. Okay, so that is how this four steps of health assessment overlaps. So that is the first part. It's all about health assessment. So basically, it's just like a review because in your health assessment lecture part, thoroughly madidiscuss yung part na yon, yung health assessment. And then about yung subjective data, the health history, and all other things na tinatanong natin sa pasyente when they go to the hospital or to the clinic or to other healthcare setting. So na-discuss natin siya previously. Okay, that is through interview. And di ba, nag-interview kayo ng inyong family member so that you can get the feel on how to conduct an interview and how to get a health history from a patient. Okay? So after that, after gathering the subjective data, so the next thing that you have to collect to your patient is the objective data, and that is through physical examination. So that will be our next topic. So collecting objective data through physical exam. So when we say objective data, so it includes information about the client, that the nurse directly observes during interaction with the client, and information elicited through physical assessment or examination techniques. So ito yung mga information na nakukuha ni nurse, okay, by physical assessment or physical examination. So to become proficient with physical assessment skills, the nurse must have basic knowledge in three areas. So ano-ano to? First, types and mga operation of equipment needed for particular examination. So mamaya we will see kung ano-ano yung mga equipments na to na dapat you are familiar. And dapat you know um, how to use these equipments. Next, preparation of the setting, preparation of oneself and the client for the physical assessment. And then third, yung performance na ng four assessment techniques, which includes inspection, palpation, percussion, percussion, and auscultation. So IPPA or IPA. So those are the four assessment techniques na isa-isahin natin mamaya. So we will first discuss the different equipments na pwede nyo magamit in your physical examination. So each part of the PE or physical exam requires specific pieces of equipment. So prior to the examination, you have to collect the necessary equipment and place it in an area where the examination will be performed. So bago pa ang pag-conduct ninyo ng physical exam, dapat lahat ng equipments nyo are already available and ready na. Okay? Para kapag i-conduct nyo na yung physical exam, andyan na siya sa tabi mo. Okay? Kukuhanin mo na lang. Okay? Next, we have now the different equipments. Okay? So, ito sila. I will be running through lang sa different equipments na pwede nyo ma-encounter. So, for all examinations, we have gloves and gowns. So, depending on the type of examination na gagamitin natin. So, we may use gloves and then gowns as well. So, this is depending on your agency and depending on your protocol. So, gloves and gowns may be used for all examinations. Okay, because this will protect the examiner in any part of the exam when the examiner may have contact with blood, body fluids, excretions, and contaminated items. So, kapag tayo ay magkakaroon ng direct contact sa mga nabanggit ko na to, then we have to wear this protective equipments natin. Okay? So, gloves and gowns. Next, for vital signs, so commonly, ito yung mga ginagamit natin. So, you have the sphygmomanometer. This is used to measure your blood pressure. Okay, sphygmomanometer. And then you have your stethoscope. And then thermometer. We have three types of thermometer. You have the oral, rectal, tympanic to measure body temperature. So, the most common now is a tympanic temperature or thermometer, tympanic thermometer to get our temperature. Next, you have watch with second hand. So, kailangan nito, no, for kapag tayo nag-duty, watch na may second hand so that we can record the time of the heart rate and the pulse rate. So, ginagamit natin yung ating watch with second hand para ma-determine yung heart rate and pulse rate heart rate or pulse rate ni patient. Even the respiratory rate sometimes, um, definitely ginagamit natin din yung ating watch to determine the respiratory rate of the patient. Okay? Cycles per minute kasi yun. Si pulse rate naman, beats per minute. Okay, next, pain rating scale to determine perceived pain level. So this is an example. Okay, so next you have for nutritional status exam, we have the skin fold calipers. So kapag nandun na tayo sa pinaka-physical assessment ng different parts of the body, we will have a thorough discussion of the equipments. Pero for now, I'll just show them to you. Okay, in a glance. So you have your tape measure. Then you have your skin marking pen. Ito for nutritional status exam, you have your platform scale with height attachment to measure the height and weight. For skin, hair, and nail exam, ito, different lights. You have examination light, you have the pen light, Wood's light to test fungus, you have the magnifying glass, magic ruler, mirror for client's self-exam. Then for skin, hair, and nail exam, continuation, you have the Braden scale, you have the push or the pressure ulcer scale for feeling. So these are just questionnaires or like a form that you have to accomplish. For head and neck, you have stethoscope, small cup of water, the clients swallow during the exam. For eye exam, you have the pen light, you have the Snellen chart, Snellen E chart, and then you have the newspaper to test near vision. So eye exam pa rin, opaque card, and then you have the ophthalmoscope. And then for ear exam, you have the tuning fork, you have the otoscope. For mouth, throat, nose, and sinus exam, pen light, 4x4, small gas pad, tongue depressor, otoscope. Again, kapag nandun na tayo sa specific part of the body kung saan natin magagamit yung mga equipments na yan, doon natin sila i-discuss thoroughly. Pero for now, I'm just showing it to you. Next, you have, ayan. So, again, just the same. Measure ruler, stethoscope. So, same lang din kanina. This is for peripheral vascular exam. Ang naiba, we have here a Doppler ultrasound device. Okay, for musculoskeletal, we have here a goniometer to measure the degree of flexion and extension of the joints. Okay, so we have here a reflex hammer para to test a tendon, a deep tendon reflexes. And just the same of kanina. And then, for male genitalia, yan, you have the gloves, the pen light, specimen card for occult blood. For female, you have a vaginal speculum, bifid spatula, large swabs for vaginal exam. Okay, so those are the equipments na pwede nyo ma-encounter or that you have to prepare, okay, before you conduct your physical examination. So you should be familiar with them and you should know how to use them. So after preparing the equipment, you should now prepare for the exam. So how do you prepare for the exam? First, by preparing the physical setting. So syempre, yung environment muna, yung setting muna yung prepare mo. So the physical exam may take place in a variety of settings such as in the hospital room, outpatient clinic, physician's office, school health office, among others. So you have to ensure that the examination setting meets the following conditions. So ano dapat yung examination setting na ating aayusin for the physical exam? Should be comfortable, warm room temperature. So you have to provide a warm blanket if the room temperature cannot be adjusted. So hindi pwedeng masyadong malamig, hindi rin pwedeng masyadong mainit yung room na paggagawaan ng examination. Private area, free of interruptions from others. So dapat private siya. Okay, kasi you will be exposing the different parts of the body of your patient. So dapat exclusive lang sa inyo yung room. Okay, between the examiner and the patient. Next, quiet area, free of distractions. So you have to turn off the radio, television, or other noisy equipment. Adequate lighting. So dapat definitely, para sa'yo, makita mo mabuti, dapat adequate yung ilaw. So it is best to use sunlight if ever available. So good overhead lighting is sufficient. And then a portable lamp is helpful for illuminating the skin and for viewing shadows or contours. Now for firm exam table or bed at a height that prevents stooping. So a rolled up stool may be useful para sa mga examiner when it is necessary to sit for parts of the assessment para na-adjust siya. Okay, so, and then a bedside table or tray to hold the equipment needed for the examination. So after preparing the setting or the environment, you now have to prepare oneself. Prepare yourself now. So this is achieve self-confidence in performing a physical assessment by practicing the techniques in a classmate, friend, or relative. Now, since you are a student nurse, so you have to practice first. You have to practice so that you can gain self-confidence in performing physical exam. Okay, so practice um makes better or makes good improvement, diba? So prepare by preventing the transmission of infectious agents. So you have to prepare yourself by keeping yourself protected then. Okay, so you have to prevent uh, the transmission of infectious agents, and that is by adhering to the standard precautions. Okay, um, to be followed by all healthcare workers caring for clients. So, meron tayong specific precaution or combination of precautions varies yan with the care to be provided to our patient. For example, pag you are performing venipuncture, okay, tutusok ka lang sa iyong client, you only, it only requires gloves, okay, for venipuncture. But intubation, for example, requires gloves, gown, and face shield, mask, or goggles. Okay, so ito yung ating general principles while performing a physical assessment. Okay, so first, you have to wash your hands before beginning the exam, and then immediately after accidental direct contact with blood or other body fluids, and after completing the physical exam. So, meaning, wash your hands before, and then if you have contact with any blood or fluids, and then after the physical exam. And then always wear gloves if there is a chance that you will come in direct contact with blood or other body fluids. And then if you have an open cut or skin abrasion, if you are collecting body fluids, dapat naka-gloves ka rin yan. And then if you are handling contaminated surfaces, okay? And then change your gloves when moving from a contaminated to a clean body site. And then between patients, so dapat nagpapalit tayo ng gloves. Okay, kapag marumi na or every time na tapos na tayo sa ating pasyente and then moving to another patient. Okay, so and then when you are performing an examination of the mouth, an open wound, genitalia, such as vagina or a penis or rectum, so you have to wear your gloves. So if a pin or other sharp object is used to assess sensory perception, discard the pin and use a new one for your next client. And then you have to wear a mask and protective eye goggles if you are performing an examination in which you are likely to be splashed with blood or other body fluid droplets. So para protected yung iyong mata and yung iyong mouth. Okay? Now, the third one, so you have prepared the setting or the environment, you have prepared yourself. The third one is approaching and preparing the client. So first, you have to establish definitely nurse-client relationship during client interview before the physical examination takes place. So definitely, nakapag-establish ka na ng rapport during the interview, right? So, after that health history taking, you will be doing the physical examination. So, it is very important na continuous pa rin yung iyong communication and yung relationship, yung working relationship mo with your client or with the patient. So, at the end of the interview, you have to explain to the client that the physical assessment will follow and describe what the examination will involve. Okay, so andyan yung example on how you're going to state that to your client. Kindly read na lang. So, and then you have to respect the client's desires and requests related to the physical exam. For example, ayaw ni pasyente na ipa-examine yung kanyang breast or genitalia, you have to you have to abide or you have to somehow follow his request or grant his or her request. Pero you should be able to explain then to your patient the importance of the examination and yung risk of missing important information if any part of the exam is omitted. Okay, pero ultimately, whether to have the examination is the client's decision. Nasa sa kanya pa rin yun kung gusto niya or hindi. Okay, so some healthcare providers ask the client to sign a consent form before exam, okay, before PE, especially in situations where a vaginal or rectal exam will be performed. So if that is the case, you have to refer to your institutional policy. Okay, check your agency policy in terms of the consent form. And then um, or in conducting the physical exam, so you have to begin with less intrusive muna. Okay, yung mga hindi muna, yung mga medyo light lang muna na physical exam, less intrusive. Okay, such as measuring the client's temperature, pulse, blood pressure, height, and weight. Parang this is the basic. Okay, yung medyo light lang, like the getting the vital signs. Okay, and then throughout the exam, continue to explain what procedure you are performing and why you are performing it. So, mahalaga na binibigyan natin siya ng instructions and ng education or health education if ever, or if applicable. And then, sinasabi natin yung reason or yung purpose why you are doing such examination. So approach the client from the right-hand side of the exam table or bed because most exam techniques are performed with the examiner's right hand. Okay, so right-hand side kang pwesto, most especially if you are right-handed. Okay, even if the examiner is left-handed, he or she will do the same. You may ask the client to change positions frequently. So, kasi in physical exam, we will be asking the client to change position frequently depending on what part of the body we are examining. Okay? So, and in so doing, dapat alam nyo yung mga different positions. Okay? So here, I'll just show you, I'll show to you the positioning. Okay, positioning the client during the exam. So first, we have here the seating. Okay, so seating, definitely yung nakaupo tayo. Okay, nakaupo si client or si patient. So this is useful because it permits full expansion of the lungs and it allows the examiner to assess symmetry of upper body parts. So this is the first, okay? So, if the patient is too weak to sit, so dapat, um, pwede silang humiga, they may lie down with meaning the face up sila and rest throughout the examination. Kung, for example, matanda yung ina-examine at hirap maupo, so they can just lie down, okay? Or if kaya namang mabilisan lang yung pag-upo, so we have to do it quickly. Okay, so an alternative position is for the client to lie down nga with the head elevated. So this is seating position. So alam na natin yan because we ourselves ginagawa natin yan. Next, supine position. So nakahiga lang basically. Lying or lie down with the legs together on the examination table. So pwede tayo maglagay ng pillow under the head to promote comfort. So, itong position na to, it allows the abdominal muscles to relax and provides easy access to peripheral pulse site. So, yung mga ina-assess dyan includes head, neck, chest, breast, axilla, abdomen, heart, lungs, and all extremities. So, very accessible yung mga parts na yan in that position. Next, we have the dorsal recumbent position. Ito si dorsal recumbent. So, the client lies down on the examination table or bed with the knees bent. So, parang supine lang siya, pero yung knees niya, okay, naka-bend. And then, legs are separated. And then, the feet flat on the table or bed. So, just like that. So, this position may be more comfortable than a supine for clients with pain in the back or abdomen. So, ano yung mga pwedeng i-assess in this position? You have your head, the neck, the chest. Okay, the neck, the chest. Then you have the axilla, lungs, heart, extremities, present peripheral pulses. Kaya lang yung abdomen, you should not be assessing the abdomen in this position because the abdominal muscles are contracted kapag ganito yung position. Okay, next one, Sims position. Ito siya. So the client lies on the right side or left side. So either right or left side with lower arm placed behind his body just like this. And the upper arm naman, the upper arm flexed at the shoulder and elbow. Okay? So the lower leg is slightly flexed then. Slightly flexed at the knee while the upper leg is flexed at sharper angle and pulled forward. So this position is useful for assessing rectal and vaginal areas. So doon natin siya ginagamit to examine the rectal and the vaginal areas for female. So the client may need some assistance getting into this position. Next, we have the standing position. So you already know this. So the client stands in a normal, comfortable resting position. It allows the examiner to assess yung posture. Ang tinitignan natin dito, yung balance and yung gait. Yung paglalakad ng patient. If ever na he or she is in standing position. So this position also used for examining the male genitalia. Next, prone position. So the client lies down on the abdomen naman with the head on the sides. So this is used primarily to assess the hip joint. So clients with cardiac and respiratory problems cannot tolerate this position. So kung may problem sila with the heart or their lungs, baka mahirapan silang to use this position. Next, you have the knee chest position. The client kneels on an examination table with the weight of the body supported by the chest and knees. Okay, so ganito yung position niya. So it is useful for examining the rectum. Kaya lang this is maybe embarrassing and uncomfortable for the client. So therefore, the client should be kept in this position for as limited time as possible. So kailangan mabilisan lang. So elderly clients and clients with respiratory and cardiac problems, mahirapan din silang pumosisyon ng ganito. And then the next one, the last for this position is the lithotomy position. Meron pang other types of position, pero these positions na mga nabanggit ko are the most common and basic. So lithotomy, the client lies on the back, okay, with the hips at the edge of the examination table and the feet is supported by stirrups. So ayan, nakaangat siya. And may support na stirrups. So the lithotomy position is used to examine the female genitalia, reproductive tracts, and the rectum. So yan yung common purpose why we let the patient position this way. So it is best to keep the client well draped during the exam. Okay, so kailangan nakadrape yung pasyente. So those are the different positions, common positions na pwede nating ipagawa sa pasyente so that we can so that our physical examination can be facilitated. Now, our next focus of discussion is about the physical examination technique. Okay, ano ba yung different techniques ng physical exam? We have 4, di ba? IPPA or IPA. So you have the inspection, you have the palpation, percussion, and auscultation. Okay, so again, yun na nga for basic techniques na you have to master in performing the physical exam, IPPA, okay, inspection, palpation, percussion, and auscultation. And then after performing each of the four assessment techniques, examiner should ask yourself about the following kapag natapos mo yung, for example, itong apat na technique. Did I inspect, palpate, percuss, or auscultate any deviations from the normal findings? Now, if there is a deviation, is it a normal physical, baka gerontologic, or baka cultural finding to? So, an abnormal adult finding or an abnormal physical, gerontologic, or cultural finding. So, you should be asking yourself about this. So, based on my findings, so I need to ask the client more questions to validate or obtain more information. And based on my observations and data, do I need to focus my physical assessment on other related body systems? And then should I refer the client ba and the data findings of primary care provider? So you have to reflect and answer these questions after performing a physical examination. So for the gerontologic consideration, so some positions, yung mga positioning na binanggit natin kanina may be very difficult or impossible for them, yung mga matatanda, to assume or maintain because of the decreased joint mobility and flexibility. So therefore, you have to try to perform examination in a manner that minimizes position changes. Okay, so dapat careful tayo and minimal lang yung positioning na ipagawa natin sa kanila, yung kaya lang nila, tolerable for them. So, you have to allow rest periods for them. And then, minsan, older clients may process information at slower rate. So, therefore, you have to um, teach and speak in a clear and slow manner. Okay, so the first one of the physical examination technique is inspection. So it involves using the senses of vision, smell, and hearing to observe and detect any abnormal findings. So usually we use our senses for the inspection, right? So it is used from the moment that you meet the client and continues throughout the exam. So from the beginning and then during the exam, so continuous yung ating inspection. It precedes palpation, percussion, and auscultation. So, ibig sabihin, nauuna lagi sa inspection before palpation, percussion, and auscultation because yung latter techniques such as palpation, percussion, and auscultation, it can potentially alter the appearance of what is being inspected. For example, pwede mag-change ng color kapag nag-percuss ka or nag-palpate ka. So dapat you really have to do first the inspection. Now, although most of the inspection involves the use of the senses only, a few body systems require the use of special equipment. So commonly, talagang we only use our senses. Pero sometimes we use equipment such as ophthalmoscope for the eye and an otoscope for the ear inspection to help us visualize the structure. Okay, so guidelines in inspection. So make sure that the room is a comfortable temperature. So alam na natin na dapat hindi masyadong mainit, hindi masyadong malamig. And then use good lighting, preferably sunlight. Look and observe before touching. So look and observe muna before you touch and then completely expose the body part you're inspecting while draping the rest of the client. Kailangan dine-drape natin si patient para hindi expose yung kanyang other body parts. Note that the following characteristics while inspecting the client. You take note the color, patterns, size, location, consistency, symmetry, movement, behavior, odors, or sounds. So ito yung mga tinitignan natin when we inspect for our client. Okay, different body parts of the client. So yun, please remember this. And then you compare the appearance of symmetric body parts. For example, yung eyes ng patient, so we compare each eye. Okay, tinitignan natin, compare natin for similarities or differences. Ears, hands, arms, or both sides of any individual body part. So we compare for symmetry and appearance. So after inspection, we proceed with the second technique of physical exam, which is palpation. So palpation consists of using parts of the hand to touch and feel for the following characteristics. So ginagamit natin yung different parts ng ating kamay para maramdaman, okay, yung ating pinapalpate for the following characteristics. Texture, is it rough or smooth? Temperature, is it warm or cold? Moisture, if it's dry or wet. Mobility, kung fixed ba yan, movable, still, or vibrating. Consistency, strength of pulses, size, shape, and the degree of tenderness. So when you say tenderness, yung sakit kapag ka, for example, pinapalpate. Okay, so that is tenderness. So ito yung mga characteristics na tinitignan natin when we do palpation. So we have three parts of the hand. So you have the finger pads. So just like in this figure, the ulnar slash palmar surface, definitely yung kabaligtaran nitong dorsal surface. Okay? Kasi yung dorsal surface, ito yon. This is the back of the hand to check for the temperature. Yung ulnar and palmar surface, yung nakabaligtad dyan. Okay? So, etong three parts of our hand, yan yung ating ginagamit for palpation. So, each part of the hand is particularly sensitive to certain characteristics. So, yung bawat parts na yan, meron siyang sensitivity to different characteristics. For example, yung finger pads natin or the fingertips natin. So, sensitive yan for fine discrimination such as pulses, texture, size, consistency, shape, and crepitus. Your ulnar or palmar surface, sensitive yan sa vibrations, thrills, fremitus. And then dorsal or the back surface, sensitive yan sa temperature. So yun yung gagamit. For example, we wanted to check for the temperature of the patient. So definitely, ang gagamit is this one, the dorsal or the back surface of your hand. Okay, so the types of palpation, you have light, moderate, deep, or bimanual palpation. So the depth of the structure, the thickness of the tissue overlying that structure determine whether you should use light, moderate, or deep palpation. So depende sa kung ano yung gusto mong ipalpate or anong part na yung ina-examine mo. That would tell you kung light, moderate, deep, or bimanual palpation yung gagamitin mo. So when you say bimanual palpation, it is the use of both hands to hold and feel a body structure. So, dalawang kamay yung ginagamit natin for bimanual palpation. So, in palpation, you have to remember that the fingernail should be short and the hands should be at a comfortable temperature. So, dapat wina-warm muna natin yung hands natin before we palpate. Standard precautions should be followed if applicable. If we need to use, for example, gloves and other PPE, then you have to, depending on the situation. Then proceed from light palpation muna, laging light muna, which is safest and the most comfortable for the client, followed by a moderate palpation, and then finally to deep palpation. So laging huli yung deep palpation because that might be uncomfortable to our patient. So this is the light palpation. So how do we perform light palpation? Place your dominant hand Dominant hand, ito yung yung hand na tayo ay mas sanay gamitin. Okay? So, place your dominant hand lightly lang ha, lightly on the surface of the structure na gusto mong ipalpate. So there should be very little or no depression, less than 1 centimeter, just like this. So parang ilalagay lang natin yung ating hand, dominant hand, in areas that we would want to palpate. So you have to feel the surface structure using a circular motion. So i-feel mo yung structure na pinapalpate mo. And then you have to use this technique to feel for pulses. Ayan. So tenderness, surface skin texture, temperature, and moisture. So ito yung mga gusto nating gawin if we do light palpation. So that's the first. Next is deep palpation. For moderate muna, moderate palpation. So for moderate, dito, we depress the skin surface ng 1 to 2 centimeters or about 0.5 to 0.75 inches with, again, our dominant hand and use circular motion to feel for easily palpable body organs and masses. So note the size, consistency, and mobility of structures you palpate. So this one is an example of a light palpation. Ito, light lang to. Ito yung kanina. And then just to compare, ito na yung ating moderate palpation. You see, parang medyo may depth na siya, di ba? I mean, medyo somehow yung lalim ng the depressed na ginawa natin for this palpation, medyo different na from light. So this is the light and this is the moderate. So again, yung ating the depression or yung ating pagpapalpate na ginagawa is 0.5 to 0.75. So this one, this is the palpation of the liver using moderate palpation. And then the third type is deep palpation. So this is an example, you can see naman talaga na talagang malalim na or talagang deep yung pagpapalpate. So place your dominant hand on the skin surface and your non-dominant hand on top of your dominant hand to apply pressure. So mauuna yung dominant hand, nasa ilalim siya. So on top is yung non-dominant hand. Itong non-dominant hand yung mag-a-apply ng pressure. Okay? So again, your non-dominant hand on top of your dominant hand to apply pressure. So si non-dominant hand yung nag-a-apply ng pressure kay dominant hand so that you can feel the organ that you are palpating here. So this should result in a surface depression between 2.5 up to 5 centimeters or 1 up to 2 inches. So this allows you to feel very deep organs or structures that are covered by thick muscle. So especially kung medyo chubby or obese yung ating pasyente, so we do that. And then by manual palpation, so we use 2 hands, placing one on each side of the body part. So commonly ginagamit ito to palpate the uterus, breast, spleen. Okay? And then how do we do this? Use one hand to apply pressure and the other hand to feel the structure. So yung isang kamay is exerting pressure while the other one is feeling the structure. Okay, so note that the size, shape, consistency, and mobility of the structures that you palpate. So that is a bimanual palpation. So gumagamit tayo ng ating dalawang kamay. So that is palpation. So we're done with inspection. That's the first one. It's the first technique of physical exam. Second one, you have palpation. The third one is percussion. For percussion, So it involves tapping body parts to produce sound waves. So dito tinatap natin yung body part na examine natin to produce sound waves. So these sound waves or vibrations enable the examiner to assess underlying structures. So different assessment uses including eliciting pain. If you want to elicit pain, so we do percussion. It helps to detect inflamed underlying structures. The area feels tender, sore, or painful. So pagka nag-percuss tayo, pwedeng masaktan si patient because of that. And that is one of the use of percussion. Okay? To elicit pain to a specific area para malaman natin if there is pain or if there is abnormality. Next, determining location, size, and shape. So percussion note changes between borders of an organ, and its neighboring organ can elicit information about location, size, and shape. And then determining the density. So it helps to determine whether an underlying structure is filled with air or fluid or is a solid structure. Detect abnormal masses. So yung percussion vibrations penetrate approximately 5 centimeters deep. And then eliciting reflexes. So deep tender reflexes are elicited using the percussion hammer. So we have three types of percussion. You have direct, blunt, and indirect. So let's start with the direct percussion. So it is a direct tapping of a body part with one or two fingertips to elicit possible tenderness. For example, tenderness over the sinuses. So, pinipercuss lang natin or parang tinatap lang natin itong body part using our fingertips para makita natin kung may pain ba kay pasyente kapag tinap natin yung part na yan. Okay, so that is direct percussion. Next, you have blunt percussion. It is used to detect tenderness over organs. For example, ito sa kidneys. Okay? So, we would want to detect kung meron bang sakit na mararamdaman sa pasyente if we tap this body part or this place. So, we place one hand flat. Okay, yung hand natin is flat on that area on the body surface and using the face of the other hand to strike the back of the hand flat on the body surface. So, ini-strike natin to, tinatap natin yan. Again, the purpose is to elicit pain. Tinitingnan natin if may pain na mararamdaman or tenderness si pasyente. So, that is blunt percussion. And then, the third type of percussion is indirect or mediate percussion. So, it is the most commonly used. So, again, indirect yan or mediate percussion. So, the tapping produces a sound or tone that varies with the density of underlying structure depending on the type of structure na tinatap mo. So, it produces sound or a tone. Nag-vary siya depending yung sa density ng structure nga na tinatap mo. So as density increases, the sound of the tone becomes quieter. So tahimik lang yung sound ng tone kung dense yung organ na or yung part na pinepercuss or tinatap mo. So solid tissue produces soft tone. Again, solid tissue produces soft tone. Kung fluid yung area na yan, ma-fluid siya, it produces louder tone. And then kung air-filled naman yung tinatap mo, it produces even a louder tone. So mas malakas yung kapag air. And then moderate kapag fluid. And then pag solid yan, soft lang yung tone. So these tones are referred to as percussion notes and are classified according to origin, quality, intensity, and pitch. So ito yung intensity, pitch, length, quality, an example, origin, and then we have here the different sounds. So I'll just leave it up to you for you to read and kindly make yourself familiar with this. You have the different sounds such as resonance, hyperresonance, timpani, dullness, and flatness. So these are the different sounds that can be elicited by percussion. So please take note of this. And then we have here techniques that would help to develop proficiency in the technique of indirect percussion. So how do we do the indirect percussion? You place the middle finger of your non-dominant hand on the body part you are going to percuss. So middle finger of your non-dominant hand. So ito yung titingnan natin, itong picture na to. So this is how we perform the indirect or mediate percussion. So non-dominant hand, ito siya. And then middle finger, and then yung taga-tap natin is our dominant hand using our fingertips. So explain ko na lang how do we do that again. We use the non-dominant hand, our non-dominant hand, yung middle finger, ilalagay siya sa structure na you would like to percuss or to tap. And then using our dominant hand, we tap that middle finger. Okay? And then ang igagalaw lang natin is our wrist, not this arm natin, hindi itong not this part. So ito lang yung igagalaw natin to exert pressure. And then make sure that your fingernails na ipangtatap mo or your fingernails are short. Okay? Because baka definitely magkasugat ka pa if ever na mahaba yung ating fingernails. So basically, iyon yung nakalagay dito on how we can develop proficiency in indirect percussion. Okay, so now how do you practice percussing? So practice percussing by tapping your thigh to elicit a flat tone. So mag-practice kayo using your thigh, and then with that you can elicit flat tone. And then you can tap your puff out cheek to elicit a tympanic tone. So pag tinap mo, puff out ka ng cheek mo and then you tap it, you can elicit a tympanic tone. So that is an example. Okay? And then the last technique of physical examination is auscultation. So it is a type of assessment technique that requires the use of a stethoscope to listen for heart sounds, movement of blood through the cardiovascular system, movement of the bowel, and movement of air through the respiratory tract. So in auscultation, again, gumagamit tayo ng stethoscope. So commonly ginagamit natin siya to hear the bowel sounds and definitely the cardiovascular system or our heart. And then stethoscope is used because these body sounds are not audible to the human ear. So the sounds detected using auscultation are classified according to intensity. Pag sinabi intensity, is it loud or soft? Pitch, the high or low? Duration, yung length. And then the quality, is it musical, crackling, or raspy of the sound? So I place here on how to use the stethoscope. So definitely this is the stethoscope. We have different parts. You have the earpiece, metal tubing, the rubber or plastic tubing, and then you have here the chest piece. So for the chest piece, you have two parts. You have parang two faces. Kapag itong part na to, this is the bell. Pag itong puti na to, this is the diaphragm. Okay? So please read how do we use properly the stethoscope. Ito naman yung do's and don'ts natin in using a stethoscope. You have to warm the diaphragm or bell of the stethoscope before placing it on the client's skin kasi lumalamig siya. So baka magulat si patient mo kapag or maging uncomfortable sa kanya if that is cold. And then explain what you are listening for. And then do not apply too much pressure when using the bell. Ito yung bell natin, Too much pressure will cause the bell to work like the diaphragm. So, dapat light pressure lang kapag ka bell. And then avoid listening through clothing which may obscure or alter sounds. Okay, so that is the stethoscope. Please read the instructions there on how to use that stethoscope. Now, in auscultation, ano yung mga guidelines na dapat nating sundin? Eliminate distracting or competing noises from the environment. So, kung maingay yung environment mo, mahihirapan kang marinig, yung gusto mong marinig, using the stethoscope. Expose the body part you're going to auscultate. Okay, wag mag-auscultate through the client's clothing or gown. Use the diaphragm of the stethoscope to listen for high-pitched sound. Ano-ano yung mga parts na to. Ang diaphragm dapat yung gamitin. This includes normal heart sounds, breath sounds, and vowel sounds, and press the diaphragm firmly on the body part being auscultated. And then, you use naman the bell of the stethoscope to listen for low-pitched sounds, such as an abnormal heart sounds and broods, such as abnormal, loud, blowing, or murmuring sounds. So that is a brood. Hold the bell lightly on the body part being auscultated. Kung bell yung gagamitin natin. Okay, so that is how, so these are the guidelines or instructions on how to auscultate. So that comprises our discussion for the physical examination technique. So again, we have four techniques. First, we have discussed inspection, followed by palpation. Third is percussion, and fourth is auscultation. So I hope you have learned something from this topic, and thank you for listening.